my name is Tess Saladay. I'm a student at the University of Memphis. Today is Sunday, January 15th, and it is 2:30 p.m. I'm going to be doing my head-to-toe assessment. I'm going to begin by assessing his skin. I'm assessing his skin for color, temperature, moisture, texture, edema, bruising, turgor, scars, lesions, and nevi. I'm assessing the skin of his head and face, neck, anterior, posterior, chest, and abdomen. Next, I'm going to inspect his head size, symmetry, and midline position. I'm going to inspect and palpate his head and scalp, looking at his hair color, texture, and distribution, palpating for any lesions, masses, infestations, depressions, noting for any tenderness. Are you tender?
Nope.
I'm going to move on to palpating his temporal arteries for any tenderness. Are you tender?
No.
Next, I'm going to assess his lymph nodes, starting with his preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I'm next going to assess his TMJ. I'm going to have you open and close, assessing for any tenderness, crepitus, or subluxation. I'm next going to assess cranial nerve 5, starting with the motor aspect by having him clench and palpating over his masseter muscle. I'm then going to assess the sensory aspect by having you close your eyes and applying light touch sensation. Tell me where you feel this.
Forehead, cheek, nose, chin.
Great. I'm going to assess cranial nerve 7 for facial symmetry. I'm going to have you smile, frown, puff out your cheeks, kiss your lips, and raise your eyebrows. Perfect. I'm going to move on to your ears. I'm noting their shape and position, palpating both your pedant and your tragus, looking for any tenderness or masses. Do you have any tenderness?
No.
Okay. I'm then going to inspect your auditory canal and your tympanic membrane bilaterally, noting that your tympanic membrane is intact and pearly gray. I'm then going to assess cranial nerve 8, assessing your hearing, beginning with the whisper test. If you could include one ear for me and repeat after me. 1, 2, 3.
1, 2, 3.
And the other.
ABC.
Great. I'm going to move on to the Weber's test, assessing for lateralization. Can you hear this in one or both ears?
Both.
Great. I'm going to assess for the Ryan's test. Tell me when you can't hear this.
Now.
And can you still hear it?
Yes.
Great. And this side. Tell me when you can't hear it.
Now.
And can you still hear it?
Yes.
Great. Air conduction is greater than bone conduction. I'm going to move on to your eyes, assessing your lashes, your brows, your palpebral fissures, looking at your sclera and conjunctiva, noting that your sclera is white, your conjunctiva are pink. There is no lesions or discharge noted. I'm going to assess cranial nerve 2, assessing your gross visual acuity using the Snellen chart, standing 6 feet away. I would have you cover one eye and read the lowest line that's clearest to you.
EPTZO.
And the other?
EPTZO.
Great. And then I would assess his peripheral and central vision by standing behind him. Cover one eye for me, please. Tell me when you see my hand.
Now.
And then the other.
Now.
Great. I'm going to assess cranial nerve 3, assessing for a direct and consensual pupillary reaction to light by shining a light. Great. And the other eye. Perfect. I'm going to assess for accommodation and convergence by having you look at my finger, look at the wall, the back of my finger, and look at the other wall. Perfect. I'm going to assess cranial nerves 3, 4, and 6, assessing his conjugate gaze with extraocular movement. I'm going to have you follow my finger without moving your head. Great. Next, I'm going to assess red reflex, looking at your internal structures. Great. Red reflex is present and no abnormalities. I'm going to move on to your nose, noting that your nose is midline and straight. I'm going to assess cranial nerve 1 for your sense of smell. If you could close your eyes and tell me what you smell.
Candle.
Great. I'm going to assess for nasal patency bilaterally. If you could occlude one nostril and breathe up and the other. Perfect. I'm going to palpate your frontal and maxillary sinuses. Do you have any tenderness?
Nope.
Great. Next, I'm going to move on to your neck. First, beginning with palpating your trachea, that it is midline and straight. I'm going to assess your thyroid gland, if you could swallow, and again. Great. I'm then going to palpate your carotid arteries bilaterally. I'm then going to auscultate your carotid arteries using the bell, listening for any bruise. If you could turn one direction for me, take a deep breath in and hold it. Okay, breathe, and then look the other direction, take a deep breath in and hold it. Perfect. Okay, I'm going to move on to your chest. If you could turn around, I'm going to look at your posterior chest. I'm going to begin by assessing for any signs or symptoms of respiratory distress. I'm looking for use of accessory muscles, tripod position, nasal flaring, retraction, cyanosis, or tachypnea. First, I'm going to palpate, or I'm also going to inspect for any obvious deformities in symmetry. I'm then going to palpate for symmetrical chest expansion by having him take a deep breath in. Great. I would then assess for tactile firmitus, for symmetrical tactile firmitus by having him state 99 every time he feels my hands.
99, 99, 99, 99, 99.
Great. I'm then going to percuss in all of the intercostal spaces starting above his scapula. Okay, I'm then going to auscultate in all of his lung fields starting above his scapula, rotating in a side-to-side motion. Okay, I'm going to perform echophony. If you could say E every time you feel my stethoscope.
E, 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 E.
Great, and bronchophony. If you could say 99.
99, 99, 99, 99, 99, 99, 99, 99.
And whisper pectriloquy. If you could whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Great. If you could turn around, I'm going to inspect your anterior chest. I'm assessing for any obvious deformities and symmetry. I'm also going to palpate for symmetrical chest expansion by having you take a deep breath. Great. And symmetrical tactile firmitus by stating 99.
99, 99, 99.
Great. And then I'm going to auscultate in the front. Okay. I'm next going to begin the cardiac assessment. I'm going to utilize the diaphragm of my stethoscope to assess the aortic at the second intercostal space, right sternal border, pulmonic, second intercostal space, left sternal border, Erb's third intercostal space, left sternal border, tricuspid, fourth intercostal space, left sternal border, and mitral, fifth intercostal space, midclavicular line, and then using the bell over the aortic, pulmonic, Erb's, tricuspid, and mitral. I'm also going to auscultate the apical pulse for 1 full minute, noting the rate and rhythm. It is regular and 68. I would also palpate the PMI at the fifth intercostal space of the midclavicular line. I'm then going to have you walk to the couch and lie down in a 30 to 45 degree angle so that I can assess for any JVD and jugular pulsation. I would also inspect for any heaves or lifts. I would also palpate over the cardiac points for any thrills, so over the aortic, pulmonic, Erb's, tricuspid, and mitral. I'm then going to repeat the cardiac exam lying down with the diaphragm first over the aortic, pulmonic, Erb's, tricuspid, and mitral, and utilizing the bell over the aortic, pulmonic, herbs, tricuspid, and mitral. Great, I'm gonna move on to the abdominal exam. If I could have you slide your shirt up for me. I'm first assessing for any contours or asymmetry. I'm first going to auscultate for any bruise over his arteries, utilizing the bell over his aorta, his renal, his iliac, and his femoral. I'm then going to assess for bowel sounds starting in the right lower quadrant to the right upper, left lower. I am then going to percuss in all 4 quadrants, looking for any tympany, dullness, or flatness. Great. I'm going to palpate for any tenderness or masses. And then I'm going to assess his liver on the right. Take a deep breath. Perfect. And then the spleen on the left. Take a deep breath. Neither are palpable. I'm going to have you sit back up for me. I'm going to have you come turn so that I can assess for CVA tenderness bilaterally. Do you feel any tenderness?
Nope.
Great, you can turn around. We're going to perform the musculoskeletal portion of our exam. First, I'm going to inspect and palpate the joints of your hands, your wrists, your elbows, and your shoulders. I'm inspecting for any redness, tenderness, deformities, swelling, crepitus, nodules, noting for symmetry. I'm going to then palpate the radial pulses bilaterally and assess for cap refill on each of your fingers. Great. And then we're going to begin with range of motion of your fingers. If you could flex, extend, hyperextend, and then thumb opposition, abduct and adduct. And then we're going to do our wrist. We're going to flex, extend, hyperextend. We're going to ulnar deviate, radial deviate, and rotate. And then of our elbows, we're going to flex, extend, hyperextend. And then if you want to stand up to do your shoulders, we're going to flex up. We're going to extend down. We're going to hyperextend back. We're going to adduct both, abduct out. We're going to circumduct. And then we're going to internally rotate one, internally rotate the other, externally rotate, and externally rotate. Great, and if you'll sit down, we'll do the strength. I'm gonna have you squeeze my hands. Hand strength 5 out of 5, and if you could pull your elbows up, I'm gonna have you push out and pull in. Flexion, extension, strength is 5 out of 5, and pull them back up for me and push out and pull in. And abduct, adduction, strength is 5 out of 5. I'm gonna have you shrug your shoulders against my hands. Cranial nerve 11 is intact. Next, we're going to move on to cerebellar coordination using alternating movement. So we're going to do serial finger opposition. We're going to do hand flip-flop and then finger to nose. Perfect. We're going to move on to strabnosis and graphesthesia. So I'm going to have you close your eyes. I'm going to place an item in your hand and tell me what it is.
Pen.
And then the other.
Q-tip.
Great. And then I'm going to write a letter.
A.
Great.
O.
Perfect. Next, I'm going to move on to light touch sensation utilizing a cotton pad. If you could close your eyes and tell me where you feel this.
Arm. Leg.
Great. Throughout the entirety of the exam, I have been assessing the overall color, warmth, noting your skin integrity, assessing for any edema of your upper and lower extremities. We're going to move on to vibratory sensation, starting over your proximal ulnar prominence. If you could do this and let me know if you feel this.
Yes.
And this.
Yes.
Great. And then your medial malleolus, if you could separate your feet for me. Can you feel this?
Yes.
Okay. And this one.
Yes.
Perfect. Okay, we're going to move on to your deep tendon reflexes. I'm going to start with your brachioradialis, bicep, tricep, and then your brachioradialis, bicep, and tricep. Your patellar bilaterally. Ideally, he would be hanging off a table. And then your Achilles. And your Babinski, if I can see the bottom. Thank you. Perfect. Okay, we're going to move on to the lower extremity exam. I'm going to inspect and palpate the joints of your toes, your ankles, your knees, and your hips. I'm inspecting for any redness, tenderness, swelling, deformities, nodules, crepitus, noting for symmetry. I'm going to begin by palpating for your dorsalis pedis pulses, and then your posterior tibial. Great, I'm going to assess your capillary fill of your toes. Sorry. Okay. Great. And then we're going to perform range of motion on your toes. If you could follow what my finger is doing, we're going to flex, extend, hyperextend. We're going to abduct out, adduct in. Great. And then of your ankles, we're going to dorsiflex or plantar flex down, dorsiflex up, inversion, eversion, and rotation. Good. And then we'll go ahead and check your strength. If you can fold your legs up, if you can push out and pull in, great, 5 out of 5 strength. And then push out and pull in, great, 5 out of 5 strength. And then I'm going to have you dorsiflex up and then plantar flex down, great. Okay, and then if you can stand, we'll do our knee strength. We're going to flex, extend, hyperextend, flex, extend, hyperextend, and then of your hip, we're going to flex, extend, hyperextend. We're going to abduct, adduct, circumduct. We're going to internally rotate, externally rotate, and then we're going to, of our other hip, we're going to flex up, extend down, hyperextend back. We're going to internally rotate, externally rotate, circumduct. We're going to adduct, and we're going to abduct. Okay, so we did feet, knees, hips. Okay, and then we're gonna have you turn, maybe so we can see your back a little better. Okay, I'm gonna have you flex forward. I'm inspecting your spine, noting for any tenderness, looking at the alignment and any expected curvatures, noting for scoliosis at this time. I'm gonna have you extend up, hyperextend back, laterally flex to your right, and then laterally flex to your left, and then rotate. And then we're gonna do your cervical spine, so your neck. I'll have you flex forward, extend up, hyperextend back, laterally flex to the left, laterally flex to the right, and then rotate. Perfect. And then I'm going to have you turn around. I'm going to have you walk regular towards the camera to assess your gait. And then I'm going to have you walk back towards me, assessing your tandem gait, heel to toe. You can't see on here. Walk just a little bit heel to toe for me. Okay, perfect. And then we're going to do the Romberg test. If you could face towards the camera, put your arms out beside you, close your eyes. Perfect. And then we're going to have you hop on one foot. You can hop on one foot, and then hop on the other. Perfect. And that concludes our head to toe assessment.